My name is Dr. Marko Call. Everyone else knows me as Dr. Marko because Lambassa is a bit of a mouthful. I've been a specialist cosmetic physician for 10 years, and I think in the last couple of months I've started having the pleasure of coming here to Evoque every second Thursday morning. The sort of services that I provide are basically all the non-surgical medical procedures that a cosmetic physician does. So everyone knows the name Botox and pretty much what that does. I do a variety of fillers under the Juvederm range. I also do a procedure called rolling medical needling, which I'll go into in a few details, and I also perform a procedure called sculpture, which is probably not very well known, but probably one of the most underrated procedures that is out there. I won't ask for a show of hands of anyone who has or hasn't had anything done, but is there anyone who perhaps has no idea about Botox fillers and sculpture? Or does everyone have a rough idea of what it's all about?
Probably not so much about the sculpture.
The sculpture?
Yeah.
Well, okay, I suppose everyone has heard of Botox, and it's used to relax dynamic muscles that cause dynamic wrinkles and crow's feet, frown lines, brow lines, and eyebrow manipulation and so forth. And everyone knows about the fillers where you enhance the droopy cheek. But sculpture is slightly different. Sculpture is not a filler per se. Sculpture is a fruit acid rather than a hyaluronic acid filler. Hyaluronic acid, everyone knows, is a complex sugar molecule. You're born with it in abundance, and some of the good scientists of this world found a way to manufacture it in the lab and teach people like me how to put it back in your face. There's a point where the hyaluronic acid fillers just won't cut it, and that happens when if there is excessive amount of draping of the skin or crepey skin or excessive elasticity loss. And if the elasticity that is being lost is too much, then the skin is not able to hold the filler in place. So we have this fruit acid called polylactic acid, which the brand name is Sculptra, and it comes in a white suspension, a white powder rather, which I mix with water, sterile water, days in advance. And it's placed pretty much in the same way, but its sole purpose is to actually stimulate collagen growth from the deep. So its role is not to fill, but to restore elasticity and shape. The nickname it's been given is called the liquid facelift. And that's the one where, as an alternative to surgery, instead of going and spending $20,000 to $30,000 on getting nipped and tucked and so forth, the other alternative is to put the Sculptra deep under the skin, and what it will do, it will stimulate collagen growth from the deep, and over a course of several weeks to several months you will see restoration of the shape of your face. And what I mean by restoration of the shape, and every woman remembers when she's 18 or 17, her face is somewhat like an upside down egg-shaped face, with a pointy end down the bottom and the broader end up top. As the years go by, that egg turns the right way up. And what Sculptra is exceptionally good at is restoring the upside down egg-shaped face by improving elasticity and creating a lift. So really, that is the one procedure that is one below the full-blown facelift. And there's certain criteria that have to be followed. You've got to pick the right person under the right circumstances. But for the right person, with the right criteria, the results can be quite exceptional. Nothing short of exceptional, actually. But it's just one of those products that's interesting, really, because the marketing gurus don't do anything with it. So it's not mainstream in the layperson's mind, but it is seriously underrated. That actual particular product lasts about 2 to 3 years. Yeah.
Is it expensive?
Yep. Usually, to specify, I mean, usually you're talking each vial comes in the vial, costs $880, and the majority of ladies, particularly the very, very, very mature ladies, we would need to use 2 vials at a time. Some of the younger ladies, we can use just 1 vial at a time, but each vial is $880, and 2 is multiply that by 2, and usually we need to do about 2 treatments, spaced 3 months apart, because it actually takes that long for the collagen to grow, mature, and cross-link with each other, and to actually create an effect.
And why is Botox more popular?
Branding. Simple.
And,
but having said that,
cheaper?
keep in mind that
Cheaper
Botox and Sculptra,
Different.
two completely different products,
Yeah.
and they fix 2 completely different problems.
Okay.
So your Botoxing is for relaxing the muscle movement around the dynamic muscle areas, which is notably the upper third of the face.
Yeah.
Sculptra is usually reserved for the temples and the cheeks and the jawline.
Right.
Yeah. So it's
But it
2 very,
also
very different.
relaxes the muscles.
No, the
Sculptra
Sculptra will have no impact on the muscles at all.
No?
Its sole purpose is to stimulate collagen growth
Yeah.
and restore elasticity.
Right.
Botox works simply by relaxing the muscle so it doesn't contract as hard and
Yeah.
doesn't concertina the skin.
Yeah. So does sculpture make it more plump, looking more plump,
Yes.
and Botox just sort of
Stops the skin from concertinaing
Yeah,
so
yeah.
hard. So when you can't concertina your skin so hard and it remains relatively still,
yeah.
or less active, let's call
Yeah.
it, the body has a chance of laying collagen back in the wrinkle.
Yeah.
That's how the Botox works.
So would you do sculpture on me or not?
No. You're not, because you're not a candidate for it.
Oh, okay.
Yeah.
Why is that?
Why is that? Because
I'm 5 years away from it all.
because the elasticity in your skin is still quite strong.
Okay.
So if I need to lift anything in your face, I can simply do it with a small amount of the hyaluronic acid filler. So I can create a lift with it. Sculpture, I wouldn't rush into. It can be done in you. I just think there are more simpler alternatives. But if and when the day comes when you are a candidate, I'll also be the first person to tell you.
So do you inject it, or what, like how do you?
Yeah, basically, as I said, in each vial,
Yeah.
it comes as a powder.
Okay.
And 2-3 days in advance, I will mix it with sterile water to create a suspension. You come in half an hour before your procedure, you get anaesthetic cream placed over your temple, over your cheek, and down your jawline. And then after half an hour, your face is completely numb, or almost completely numb.
Yeah.
And the suspension is drawn up into the syringes, and through a needle and a syringe, I inject the suspension deep under the skin in a very similar method to injecting the fillers, except it's not a gel like the fillers are, it's actually liquid. Yeah. But you have to be patient with that. Sculpture, you need to be patient. Yeah,
Yes.
you're not going to get an instant result. No, you don't get an instant
Would I
result.
be a candidate? Yes. What?
No. If you want to know the detailed criteria as to who's a candidate and who's not, that's where the private consultation comes in. Yeah, I can't reveal everything.
Marko, can we say, and I could be wrong here, that 20 years ago it was during treating AIDS patients as well?
Yes, very much so.
So is that sunken in?
Yeah,
maybe that
basically it was originally invented and brought under the name of Newfill. It was a product designed to help HIV patients who had the aggressive treatment, and they would have extensive facial atrophy. They would be gaunt, scrawny, almost like death warmed up, and that was the medication that usually gave that look. And so rather than spending the last 6 to 12 months of their lives looking like death warmed up, they would have Sculptra injected into their faces, so it actually restored firmness, thickness and elasticity and fullness in their face. That basically went from looking badly sick to actually looking normal. And so it's just that some bright spark somewhere decided, oh, we could do this for other people. And and the rest is history. That's great. Yeah. The other thing that perhaps people may not know as well about, everyone knows Botox and fillers, as I said, but the other thing I do that people may not know much about is the rolling medical needling. I will ask, is there a show of hands, anyone who knows what that is? Okay. Think of aerating your lawn so that it's healthier, and that is effectively what is done to your face, but in a far more gentler method. With this procedure, you come in an hour beforehand, you have anaesthetic cream placed over your whole face and neck, and your décolletage as well, if so necessary. After an hour, your skin area is completely numbed, and I take a small instrument which has got a handle and a roller with several hundred titanium needles, all very, very small, all very, very skinny, and it doesn't feel anywhere near as bad as it sounds. But the whole principle behind this is that when you remove the anaesthetic cream and your face is all numb, you roll these needles over your dermis, over your skin, and after about half an hour, you've pretty much induced millions of tiny microscopic pinpricks into your dermis, and you make the dermis bleed into itself. So when the needle goes through the skin, pricks a blood vessel, the blood vessel leaks blood. The nature's natural response is to activate the platelets and activate the clotting mechanism, so the blood clots. But every time you activate a platelet molecule, it releases growth factors. And those growth factors, as they sit inside the dermis outside the vessel wall, stimulates your fibroblasts to produce extra collagen. And so when it's finished, you really don't like clean you all up. You've got no redness, or no blood rather, no holes in your face or anything like that. You basically look moderately sunburnt, and your skin feels moderately sunburnt. And that lasts about 24 to 48 hours. And the result of that, after several treatments done approximately every fortnight or every month, is that your top 2 millimeters of your skin is generating new collagen fibers, and you will find that your skin becomes more elastic, more thicker, more firmer, fine lines get more superficial, the pores get smaller, and it actually gives your skin a healthier glow. So where I talked about Sculptra earlier, stimulating collagen growth from the deep, the rolling medical needling is a procedure that actually stimulates collagen growth from the surface. And so you can, if someone was so inclined and they had both procedures, first one and the other, over a period of time, you can actually have quite a dramatic result.
So clients ask sometimes, so depending on what their skin look like, does it depend on then how many times you would use the roller, like how many times they have to come?
Yeah, usually I recommend a minimum of 3 treatments to get you at least a moderate wow factor, and if you're so inclined, I recommend up to about 6. So anywhere between 3 to 6 treatments spaced 2 to 4 weeks apart, and you will get quite a substantial improvement in everything from elasticity, texture, depth of the lines, tone, colour, and once you've had the 3 to 6 treatments, you usually then do about 1 treatment per year to maintain that result. And it's probably the most natural thing that I do. Natural because all I'm doing is stimulating your own collagen. I'm not actually introducing anything into your skin. All I'm doing is creating a controlled trauma to the dermis to actually stimulate your skin to perform in a certain way to get a certain result. It's a procedure that was actually invented many decades ago and perfected by a couple of plastic surgeons over the last 10 to 20 years. And yeah, very nice.
Must help with the absorption of product as well, if you.
Yeah, there is, the home rollers are designed for that.
Yeah, okay.
So, I mean, the ones I use are actually medical grade and considerably longer needles, because I use prescription grade anaesthetic cream to anaesthetise your skin.
Yeah.
But there is home rollers where the client can take rollers home, and they can be from 0.2 to 0.5 of a mil,
Yep.
and that purpose is to pierce the stratum corneum on your skin so that your own products can be absorbed far more efficiently.
Yeah.
At 0.2 to 0.5, it doesn't really do very much for the purposes of collagen induction.
Yeah.
You really need to go 1, 1.5, even 2 is what I usually use.
Yeah.
But if you want to get your products to get in your skin effectively and more efficiently, the home rollers are very effective and they're reusable.
Because there seems to be a lot of a lot of things out there, and there's a lot of salons which are actually doing it. But
Yes.
is what you do that's deeper again?
A lot of the salons out there at the moment are using up to 1.5 mil.
Okay.
Depends on what insurance they have.
Yeah.
So some salons will use 1.5 mil,
Yeah.
some a bit more.
Yeah.
But you have to nominate a certain insurance to cover you for certain depths.
Yeah.
What I use is 2 mil
Yeah.
as a standard routine. Every now and again I'll use 1.5, and I'll use up to 3 mil for treatment of acne scarring.
Yeah. I have to say, if I was to have that done, and I've looked at this sort of thing, I say this all the time to my clients when they talk to me about these sorts of more invasive procedures, I say, get it done by a doctor. I just think you have those letters after your name for a reason.
It's a bit sad in the sense that there's a lot of cases of the blind leading the blind when it comes to rolling medical needling. There is quite a few people out there that when I see them how they do it, they're not doing it correctly at all. This procedure is meant to be done in such a way so that you splint the head and the neck, tighten the skin so that the skin is like a tight drum. And when you pass that roller over the skin, it's meant to be with 0 pressure. So that the only trauma that's been inflicted on the skin is the actual piercing of the little, and these needles are super fine and super tiny. You're supposed to do it with 0 trauma, 0 pressure, so that the only redness you see is from the pinprick of the skin. Unfortunately, some places, because their insurance only allows them to use, say, for example, a 1 mil needle, they can't get the same erythema, the same redness, the same bleed. So the instructor or teaches them to press hard. Unfortunately, once you start pressing hard, you start introducing complications such as increases collagenase in the skin, which breaks the collagen fibers down, which is totally pointless. It increases the risk of post-traumatic hyperpigmentation. And I've seen cases of elasticity going backwards because the operator pressed way too hard with blunt force trauma. So it's meant to be done with 0 pressure. And there is a little way of doing it. It's fairly simple principles, but it's sad to see that some of those principles are not always followed. So yeah, when it comes to needling, you do have to have a very good idea of what you're doing, otherwise it can go pear-shaped.